My name is David Endicott, and I'm the president and founder of NeoTech Solutions, Inc. here in Joplin, Missouri. Our customers range in size. Our smallest customers will be 2 or 3 computers. Our biggest customers will be 3,000 or 4,000. But the real sweet spot for us is that 50 to 250 seat range. Those customers tend to be big enough to have serious IT needs and serious IT problems, but small enough to not have a full-time IT staff. Being able to provide virtualization services and world-class hardware and software and world-class services in a local setting has been a big help for us.
Access Family Care is a federally qualified health center, which means we're a community health center. About half of our patients fall within the federal poverty guidelines. Half of them do not have insurance. About 40% of them are Medicaid users.
Access Family Care came to us and wanted us to design a system to support their electronic medical records initiative that they were putting in place. And so we presented to them a solution that was based on VMware and Intel modular server that would cover all of their locations and provide a virtual desktop infrastructure so that we could do away with regular PCs and provide them access to a virtual desktop from any of their locations.
The federal government is requiring all community health centers to move towards an electronic health record. We brought those issues to NeoTech, and they helped us come up with a solution using some of this new technology with our electronic health record in such a way that once a staff logs in, they're logged in for the rest of the day, and they can move from office to office or exam room to exam room without having to take a laptop or any kind of equipment with them. Just insert their card in, wherever they were, it just pops right back up for them again.
Session portability was absolutely critical. VMware and VMware View provided us the ability to provide to the customer a virtual XP desktop that would basically follow them from device to device or from location to location wherever they went. When designing the system, one of the pieces that we had to take into account were the requirements of HIPAA for their medical records. Using a hosted type environment on an Intel modular server allowed us to keep all of those records in our data center. The redundancy that built into the server made sure that we're up 24/7, and the manageability of that server allowed us to make sure that we were in complete compliance with all of the regulations provided. VDI was critical in that, and being able to have the kind of scalability that they need to start with the number of clients that they have and scale up to where they see that they are going to be in the next 3 or 4 years made the Intel modular server a perfect fit. We know that we are going to have to provide to the customer a fully integrated system. Both documentation from the Intel ESA website and then also from VMware's website showed us how that integration was already in place, and it really put us at ease in recommending this to our customer.
We see this technology as one of those ways to help us increase efficiency so that we can increase access and provide better quality care for our patients.
We feel that virtualization is going to be the next really big technology that's adopted for businesses of all types. The more that we read and the more that we demoed the VMware product, we were able to provide them a complete virtual XP desktop, which is much closer in experience to what the customer is used to in a standalone PC. When discussing this with the customer, one of the biggest hurdles that we had to clear was their mindset about not needing hardware. Once we got across to them the cost savings involved in the reduction in management costs and the reduction in pain involved in maintaining those assets and dealing with the depreciation of those assets and so forth, and they began to look at IT services as just a cost of doing business function. It became very obvious to them this is a much lower cost way to go than traditional PCs and servers. Another strong selling point for this system was the fact that the thin client units that we were putting in use so much less power than a traditional PC.
Our IT staff is zero, pretty much zero. We resource everything out to NeoTech, because they do it all for us, and then we just send them a monthly check. And it's just so simple, so clear, and it frees us up to do what we need to do here in the clinics, and that's see patients and take care of business.